Hi guys, so today I'm going to be talking about strokes, and for you to easily remember strokes and where exactly in the brain does that happen to localize the lesion, you have to understand a few things first. First of all, you have to remember the origins of nerves. Now for the cranial nerves, there's a very easy way to remember the origin of cranial nerves. 4 cranial nerves arise above the pons, which is 1, 2, 3, and 4. So 3 and 4 arise in the midbrain and 1, 2 up higher up in the brain. All right. 4 cranial nerves arise in the pons, 5, 6, 7, and 8. And then there are 4 cranial nerves that arise below the pons, that is in the medulla, 9, 10, 11, 12. We know that 11 also arises from the spinal column, but you have to remember that it arises from the medulla as well. Now, you have to remember their locations, the location of these nerve nuclei. So there are pure motor nuclei and there are mixed nuclei. The pure motor ones are 3, 4, 6, and 12. So you have to remember that motor nuclei are always medial and mixed nuclei are always lateral. The mixed ones are 5, 7, 9, and 10. So you have to remember 3, 4, 6. Easy to remember because these are the ones that supply the eyes and help us move the eyes. So you have to remember that these are pure motor nuclei, and the 12 one is for the tongue. So these are pure motor. They don't have any sensory fibers. However, 5, 7, 9, and 10 have sensory fibers as well as motor fibers. So these are mixed and they will be lateral in the brain. Now, for the brain, you have to remember the origin of the nerves. You have to, when a question comes and it is about a stroke and it's telling you that, for example, the right side of the arm and the right side of all of the body has, the right side of both limbs has decreased sensation. So you would have to create an image in your brain where exactly the lesion is. For that, you have to know about the cross sections of brain. Now, there is a very easy way to remember these cross sections. It is how I remember them. So this is like a very minimal diagram of the medulla oblongata of the brain. I've only drawn half of it and I've labeled very few of it. So you have to first of all divide it into 2 halves. This is the right half and this is the left half. Okay. And you have to remember, and then you have to divide it further into medial and lateral. So if I draw a line over here, somewhat like this would be the medial part and this would be the lateral part. Right? So you have to remember what would be in the medial medulla and what would be in the lateral medulla. Now, as I told you that the motor nuclei, pure motor nuclei are going to be medial. So you have to remember which nuclei arise from the medulla. So as you can see, 9, 10, 11, and 12. Which one of these is a pure motor nucleus? It is 12. So 12 is going to arise medially. Here you go. The medial lemniscus carries sensations, and medial lemniscus, as the name suggests, is medial, but as you go up, it goes lateral. So you have to remember that from the medulla up to the pons and then into the midbrain, it goes medial to lateral, like diagonally. This is how you're going to remember it. So for bottom down, it's going to be medial. So medial lemniscus is medial. And then you have the medullary pyramids. So these contain the corticospinal tract, the fibers, the pure motor fibers. So these are going to be medial. So what things do you have medial? You have the pure motor nucleus. Of course, you're going to have it medially. You're going to have the motor fibers medially. Of course, you're going to have the medially. And you have the medial lemniscus, as the name suggests. Okay. This is the lateral corticospinal tract, but it says lateral, but it becomes the medullary pyramid, which is medial. So you have to remember that that it is different, and you have to remember that the pure motor fibers are going to be medial always. Okay, so laterally, what do we have in the lateral medulla? So you're going to have the mixed fibers or the sensory fibers. So first of all, we're going to go easy. We're going to see that the lateral spinothalamic tract is here, right? Because it carries the sensations. It is a sensory tract. Then you have the nucleus ambiguous, and it carries, it has input from cranial nerve 9, 10, and also 11. So it's going to have fibers from all these, these are mixed nerves, right? So the nucleus is going to be lateral. And then you have the inferior cerebellar peduncle over here. Okay, and then you have a few of the structures that I haven't labeled here because they're not as necessary to remember. I'm gonna keep it as simple and easy as possible. So then you're gonna have to remember what arteries supply the medial part of the medulla and the lateral part of the medulla. So I've written these down here. Medial part is supplied by the anterior spinal artery, the branches of the anterior spinal artery, and the lateral part is is supplied by pica, which is posterior inferior cerebellar artery. This is very, very, very important. You must know this, because if you damage the anterior spinal artery, what are you going to get? You're going to get medial medullary syndrome. If you damage pica, if the blood supply is stopped somehow to the lateral part of the medulla, you're going to get lateral medullary syndrome. And it is extremely easy to remember what happens in these two syndromes once you can quickly draw this, in your brain. Just like recall this diagram in your brain. It's very easy. There's only three things that are in the medial medulla that you have to remember: cranial nerve 12, the medial lemniscus, and the corticospinal tract. So if ASA gets damaged, you're gonna get cranial nerve 12 damage. What's that gonna do? It supplies the tongue. So you're gonna get deviation of the tongue. Tongue always licks the wound, so it's gonna go to the side that is damaged. The tongue is going to deviate to the damaged side. For example, the right side, the right nucleus gets damaged, so tongue is gonna deviate to the right side. For example, this is the tongue. You ask someone to stick their tongue out and they have this damage, so their tongue is going to deviate to the right side. And of course this diagram is really bad, but you get the idea, right? I hope you do. Then you're going to damage the medial lemniscus. If you damage the medial lemniscus, you're going to get decreased proprioception contralaterally, because you know that medial lemniscus, it comes from the opposite side. And for the medullary pyramid, you're going to damage this. So you're going to damage lateral corticospinal tract. And what's going to happen if you damage the corticospinal tract? You're going to get contralateral paralysis of upper and lower limbs. So medial medullary syndrome is going to damage these three things, and this is how you're going to remember them. So lateral medullary syndrome, what's going to happen in lateral medullary syndrome is you're going to damage the inferior cerebellar peduncle. So you're going to get ataxia, right? Very easy. Lateral spinothalamic tract is damaged. What you're going to get? You're going to get decreased pain and temperature sensation from contralateral body. Okay, again, easy to remember. If you damage the nucleus ambiguus, which is 9, 10, and 11, this carries the sensations for swallowing. So you're going to get hoarseness, dysphagia, and decreased gag reflex. And this is the inferior olivary nucleus, and there's going to be some sympathetic fibers here, so you're also going to get ipsilateral Horner syndrome. But it's easy to remember that you're going to get you're going to lose some sensations, you're going to lose the ability to swallow, and you're going to have ataxia and dysmetria, right? So if a question comes where, for example, there's a patient who comes in and has deviation of tongue to the right side, and they give you this cross section, which would be way better than the one that I've drawn, and they ask you to localize the lesion, you would say it's the medial medulla, because where do you see the nucleus for cranial nerve 12? You see it in the medial medulla. If they give you a question where there's ataxia, there's dysphagia, and there's also loss of sensation in the right side of the body. If there's loss of sensation in the right side, you go to the opposite side. So there's the problem in the left lateral spinothalamic tract, and you would know that it's the left lateral medullary syndrome, right? So this is how you're going to remember. Just very easy, quick and easy diagram. You could either draw it or just just try to remember this diagram, draw it as many times as you want, and this should be on your fingertips. Like, you should remember these quick and easy tidbits, just a little bit here and there. So on the exam day, you can just recall it in a second in your brain, and you know exactly where the lesion is. I hope this helped you. If you have any further questions, please comment below, and please subscribe to my channel. Thank you for watching.